Well, Pride Month is a celebration of the LGBTQ plus community, but it also is a time to recognize the unique challenges its members face. There's strong evidence that LGBTQ plus adults are twice as likely to experience mental health issues than heterosexual adults, while frequently struggling to find care that they need. Dr. Andy Cruz is the co-founder and chief medical officer of Guidelight Health, joining us now to talk more about it. Thanks for coming in.
Thanks for having me.
Appreciate it. So, Andy, the mental health of this group is important to you. Talk about why.
I guess I wear two hats. I come to you as a psychiatrist, a missional psychiatrist, born in Texas. My family didn't have access to mental health care. I trained at Mass General, McLean, Harvard, saw amazing health care, and I just think that should be for everybody, including people like my family in small rural towns. And then I also come to you as a gay man who has experienced stigma in my life and has lots of friends that have experienced the same. And so I just think it's so important to build healthcare for everybody, and then I have a special place in my heart for the LGBTQIA plus community.
Yeah, you know firsthand how it feels in the struggle to find that care, which is why clearly you're very passionate about it. So Guidelight recently started a program in Denver specializing in group counseling for the LGBTQ community. Talk about why you guys decided to do that.
100%. First, maybe important to name that there will never be enough clinicians in my lifetime to offer specialized care for everyone. So all Guidelights around the country have a safe space for anyone to go to. And when you can get group therapy among your peers, people who have suffered in the same way you have, people that have experienced joy in the same way you have, it's just that much more powerful. So where we've built scale, where we have a large presence, we leverage that and we build these specialized programs. Here in Colorado, we've built a program called PRISM for the LGBTQIA plus community. And
it's a group program, which sometimes can be very helpful too, right?
100%. I'm a psychiatrist who believes maybe 50% of what we do is science and the other 50% is art. And that art is all like connection. And it's so much easier to connect with people that you just share something with. So yes, we believe that group therapy is so powerful, and it also leverages one amazing therapist can see one person in 45 minutes in the community, but one amazing therapist can treat 10 people just as effectively in group therapy, group programming.
How can people not in the community better support friends and family who are?
100%. I think curiosity is a good place to start. You know, everyone has preconceived notions about any given community. I think asking questions, I think reading, and trying to stay as far away from, advice as possible and more just, being curious. What's your experience? How can I be helpful? Those type of things are the best places to start.
More understanding and open heart to everyone and everything in every community.
Exactly.
Is so important. If someone is interested in this, let's say they have individual therapy right now, but they're like, oh, group would be great. PRISM sounds really great to me. How can they get involved?
100%. You can go to our website, guidelighthealth.com. All the information is there. You're able to call us. You're able to self-refer in a very easy form. I would say that if you're in individual therapy and it doesn't feel like enough, that is when our type of programming, our levels of care, which treat people in crisis, people needing a little more structure and support, you should just reach out. The initial evaluation we don't charge for, and if it's a good fit, we would love to treat you, and if it's not, we'd love to get you where you need to go. So I think if there's any inkling that maybe what you're getting in outpatient is not enough, at no fault to the outpatient clinician or anything. Reach out. We're happy to evaluate you. We're happy to support you and get you where you need to be.
Everyone works differently, and this just might be another thing to add to the tool belt for things.
100%.
All right, Andy, thank you so much for coming in.
Thank you for having me.
Really appreciate it.